So would you recommend C-section scar massage for every mom who has had a C-section, or just specific moms who are having issues?
I would say everyone would benefit from doing some C-section work
Okay.
for sure.
Right. Is there anyone that would need to avoid it at all?
In most cases, no, I would say. Again, depends on the outcomes, right? If someone is not concerned about their scar, like we have lots of people that have never even thought about it. So, I mean, if it's not bothering them, if it feels normal, like why go and do something if it's really not a concern or a goal? But again, having those layers of fascia and having the skin and that scar tissue as mobile as possible is really important, not only for a recovery in the early days, but even long-term function as well. And I think we're going to get into that a little bit later too.
Yeah. So and I have this with a lot of my clients. I do recommend that they do the massage, and I'm
Mhm.
sure that's what you do too, even if they don't have the issue, because issues can crop up down the road, right? I always envision that, that web of connective tissue, and you can have adhesions. So this part of this, I guess, scar underneath the skin that you see could be kind of gripping over here and creeping over here. And we don't want that happening. So with your patients, are you preemptively massaging them or teaching them how to massage?
Yes, absolutely. So everyone that has had a C-section and that's coming in for therapy, and we're, just doing a baseline assessment, one of the things that we always look for is, what is the mobility of the scar like? Can you touch the scar? Does it feel tender? What's the mobility like? Because again, we do want it to, again, you talked about kind of that webbing, things get
Yeah,
bogged down, things get really stuck down. We want to make sure that that's not happening.
right, exactly. Because that can crop up and have issues down the road.
Absolutely.
Yeah. So I guess to that point, is it ever too late to start massaging your C-section? Because I know that there's a lot of moms who have had, and just finding out about this now, they're like, oh man, that was 10, 15 years ago. Is it too
Yeah.
late? Like, can I reap the
Yeah.
benefits of this?
Absolutely. It's never ever too late to start massaging your scar, get it moving, get that, again, the layers of fascia, everything moving a little bit better. Funny
Mm-hmm.
story is actually is a few years ago, I had a client who had a 12-year-old kid by a C-section. And just when I was talking to her, she was just, she happened to say, I just can't wear a yoga pants, the same way. They either have to be really high waisted so that like nothing touches it, but I
Right.
just like or really baggy so that there was no pressure on it.
Right.
And I would say within a few sessions of just getting her to start again desensitizing that scar, get it moving a little bit better, not only did it start looking better, but it also felt a lot better and a lot more normal. And
Mm.
again, she didn't even need to think about the types of clothes she was wearing anymore, because she was able to wear it all because it just felt better for her.
That's huge. Like 15 years and not, or 12 years, I think you said, and not being
Yes.
able to wear certain pants of certain height or length. That's, yeah, wow. That's,
Absolutely.
that's
And it
really great.
probably happens more often than we even let on. It's just something often that we just kind of do, and we're like, oh no, I can't buy those pants, or I'll try on those pants. And it just doesn't feel right. And we often just brush it off. But
Right.
again, people don't realize that no matter how long after, we can still get it feeling a lot more normal and more
Mhm.
comfortable.
And I think a lot of times, number one, it's because we didn't talk about these things, or didn't hear about these things, or maybe didn't have the research 12 years ago, but also because OBs and doctors aren't really talking about it, right? It's your 6 or 8 week checkup and you're good to go on your way. And they're not really telling
Mhm.
you. I've had clients in the same position. Why didn't my OB tell me I could start to touch it and do this kind of
Yeah.
stuff, right?
Yeah.
So yeah,
So
it's
yeah, and the point on that is, again, I think it's really important to put out there. It's not that doctors and OBs and midwives don't want to help, or they don't want to help with that healing process, but their lens is from a medical perspective,
yeah.
right? So they want to make sure that nothing is infected.
Mhm.
They want to make sure that it's not yellow and pussy,
Right,
and
right.
the thing, or the stitches aren't going to open up. So they want to make sure that things are healed. They're
Yeah.
not necessarily like their main concern is not necessarily like that long-term function of how that scar is moving around. So like
Right.
really, like they're your medical provider. They're there to make sure that the medical side is taken care of.
You're right. That's not their job function. You're right.
Mhm.
You're right.